This combination hormone medication is used to prevent pregnancy by containing two hormones, drospirenone, a progestin, and ethinyl estradiol, an estrogen. It also includes a folate supplement, such as l-methylfolate or levomefolate, which is a B vitamin that can help prevent spinal cord birth defects in unborn babies. This medication can also be used to treat premenstrual dysphoric disorder, PMDD, or moderate acne. Additionally, it may help make your periods more regular, decrease blood loss, painful periods, and the risk of ovarian cysts. However, it's important to note that using this medication does not protect against sexually transmitted diseases. As for the best time to take it, follow the instructions provided by your doctor or pharmacist. Before you start taking Drospirenone-Eth Estra-Levomef, make sure to read the patient information leaflet provided by your pharmacist. It contains important information on when to take your pills and what to do if you miss a dose. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily. Pick a time of day that is easy for you to remember, and take your pill at the same time each day. Continuing to take this medication exactly as prescribed by your doctor is very important. Follow the package instructions to find the first tablet, start with the first tablet in the pack, and take them in the correct order. Do not skip any doses. Pregnancy is more likely if you miss pills, start a new pack late, or take your pill at a different time of the day than usual. If you experience vomiting or diarrhea within 4 hours after taking your tablet, follow the instructions in the patient information leaflet section titled, "What to Do If You Miss Tablets." This is important because vomiting/diarrhea can stop the tablet from working. Taking this medication after your evening meal or at bedtime may help if you have stomach upset or nausea with the medication. You may choose to take this medication at another time of day that is easier for you to remember. Your pill pack contains 24 pills with active medication, hormones and folate, and 4 reminder pills, without hormones, but with folate, at the end of the pack. Take 1 active pill, with hormones, once daily for 24 days in a row, followed by 1 reminder pill, without hormones, once daily for 4 days in a row. You should have your period usually within 3 days after you take the last active tablet in the cycle. After you have taken the last reminder tablet in the pack, start a new pack the next day even if your period is continuing or if you do not have your period. If you do not get your period, consult your doctor. For the first cycle of use only, use an additional form of non-hormonal birth control, such as condoms, spermicide, for the first 7 days to prevent pregnancy until the medication has enough time to work. If you start on the first day of your period, you do not need to use backup birth control the first week. If this is the first time you are using this medication and you are not switching from another form of hormonal birth control, consult your doctor or pharmacist for information about how to switch from other forms of hormonal birth control to this product. If any information is unclear, consult the patient information leaflet or your doctor or pharmacist. Some common side effects of drospirenone-ethinyl estradiol include nausea, vomiting, headache, abdominal cramps, breast tenderness, swelling of the ankles/feet, and weight change. You may also experience vaginal bleeding between periods or missed/irregular periods, especially during the first few months of use. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. If you miss 2 periods in a row, or 1 period if the pill has not been used properly, contact your doctor for a pregnancy test. Remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. However, it's crucial to monitor your blood pressure regularly and report any high results to your doctor. Seek immediate medical attention if you experience a lump in your breast, mental or mood changes, unusual changes in vaginal bleeding, symptoms of high potassium levels, severe stomach/abdominal pain, yellowing of the eyes/skin, dark urine, shortness of breath, chest/jaw/left arm pain, sudden dizziness/fainting, pain/swelling/warmth in the groin or calf, sudden/severe headaches, trouble speaking, weakness on one side of the body, sudden vision changes, or symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other effects, be sure to contact your doctor or pharmacist. Always consult your healthcare provider for personalized advice. Remember that the best time to take this medication is determined by your healthcare provider, and it's important to adhere to the prescribed daily dosage. If you are over 35 years old and smoke cigarettes or use tobacco, it is not recommended to use Drospirenone-Eth Estra-Levomef. This is because smoking while taking this medication can increase the risk of serious health problems such as stroke, heart attack, blood clots, and high blood pressure. It is important to avoid smoking or using tobacco while using this medication to minimize the risk of these serious health issues. Before taking Drospirenone-Eth Estra-Levomef, it's important to let your doctor or pharmacist know about any allergies you may have to this medication or its inactive ingredients, as well as any medical history of blood clots, high blood pressure, cancer, diabetes, heart problems, kidney or liver disease, thyroid problems, or any recent or upcoming surgeries. If you have diabetes, it's important to monitor your blood sugar levels regularly and report any changes to your doctor. Also, inform your doctor if you will be undergoing any surgeries or extended periods of immobility, as this can increase the risk of blood clots. Additionally, be cautious of increased potassium levels, the possibility of developing skin discoloration, and potential vision problems if you are nearsighted or wear contact lenses. It's also important to know that it may take longer to become pregnant after stopping this medication, and it should not be used during pregnancy or while breastfeeding. Always consult your doctor for more information. It's important to be aware of potential drug interactions, as they can affect how your medications work and increase the risk of serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include certain medications used to treat chronic hepatitis C, as well as drugs that can raise your potassium level. It's important to note that some drugs may cause hormonal birth control to work less effectively, potentially leading to pregnancy. Always inform your doctor when you start any new drug and discuss if you should use additional reliable birth control. Additionally, this medication may interfere with certain lab tests, so be sure to inform lab personnel and your doctors that you are taking this drug before undergoing any tests. If someone takes too much of Drospirenone-Eth Estra-Levomef and experiences severe symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can contact your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. If you or someone you know experiences these symptoms after taking Drospirenone-Eth Estra-Levomef, seek medical help immediately. It is important not to share this medication with others. It is recommended to have regular complete physical exams, including lab and/or medical tests like checking potassium blood level, blood pressure, breast exam, pelvic exam, and pap smear while taking this medication. Follow your doctor's instructions for examining your breasts and report any lumps right away. It is important to keep all medical and lab appointments. Consult your doctor for more details. If you miss a dose of Drospirenone-Eth Estra-Levomef, the advice on what to do next may vary depending on the brand you are using and how many doses you have missed. It is important to refer to the product package information for guidance on what to do if you miss a dose. In some cases, you may need to use alternative birth control methods, such as condoms or spermicide, to prevent pregnancy. If you find that you frequently forget to take your pills as directed, it is recommended to speak with your doctor about the possibility of switching to a different form of birth control that may better suit your needs. When storing Drospirenone-Eth Estra-Levomef, make sure to keep it at room temperature and away from light and moisture. It's important to store it in a safe place, out of reach of children and pets. When it comes to disposing of this medication, it's important to follow proper guidelines. Do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product and it is expired or no longer needed. If you're unsure about the best way to dispose of this medication, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.